Hello?
Oh, hi, this is Mr. Nelson. I haven't been feeling well all day. I'm not eating, but my blood sugar is going up, and I wondered what should I do?
Well, hi, Mr. Nelson. I'm sorry you're not feeling well today. You may see high blood sugar anytime you're sick, have an infection, or sometimes just by not eating. Your body's stressed and trying to fight the infection or whatever's wrong. So when your body's stressed, there are hormones released to help, but they may also raise your blood sugar. Are you taking your medication?
No, I didn't think I should since I wasn't eating.
We do recommend that you continue your diabetes medications when you're sick, even if you're not eating. It is important to continue taking your insulin and diabetes medication when you're sick. Since your blood sugar will likely be higher, your body needs the medication. If you take long-acting insulin, continue to take it as usual. If you have an insulin pump, continue at your same dose. If you take mealtime insulin and are able to eat, continue to take your usual dose. If you can't eat, you may need to take mealtime or rapid-acting insulin to correct your high blood sugar. Examples of long-acting and rapid-acting insulin are listed below. If you have any questions, contact your healthcare provider.
Oh, okay. I didn't realize I should take my insulin.
Yes. Now what about food? Are you able to eat or drink?
I haven't felt like eating, but I have been drinking some Gatorade.
Great. It's important to keep hydrated, and drinks like Gatorade have added potassium and sodium, which needs to be replaced if you have diarrhea or vomiting. We do recommend you drink 8 ounces of fluid every hour. Sugar-free is okay, but if you're not eating, you need something with a little calories and sugar to replace the carbohydrates from your meal. The idea is to prevent dehydration by drinking fluids every hour. If you aren't sure you can drink 8 ounces at once, try to at least drink 2 to 3 ounces every 10 minutes or so. If you can't eat solid food, it's important to replace the carbohydrates in your meal with drinks or soft foods that contain carbohydrate. Some examples of 15 grams of carbohydrate are 4 ounces of juice or regular soda, popsicles, sports drinks, or regular Jell-O or broth-based soups.
I can try some soft foods now that I know I can take my medication. I was worried about my blood sugar going higher.
Mr. Nelson, it's good that you're monitoring your blood sugar. As you discovered, it can be higher than usual, so checking it more often when you're sick is best. You should check it about every 2 to 4 hours.
When should I be worried?
Well, that's a good question. Be sure to call your healthcare provider if your blood sugar is consistently above 250 or you take insulin and it doesn't change. If you're vomiting longer than 2 hours or have diarrhea and it lasts more than 6 hours, please call. If you test ketones and the results show moderate or large, that can be a red flag. You need help. If you use over-the-counter medications but are not getting better after a couple days, you may need to come in for a visit. And as always, if you aren't sure, please call your healthcare provider.
What? I've never done that. What does that mean?
Ketones are a sign that your body needs more fuel, either because you haven't eaten or you don't have enough insulin available. To get extra fuel, your body breaks down fat to use as sugar. Ketones are part of this process and can act like a poison in your body. When this happens, ketones are present in your urine and can be tested with a ketone stick, which are available over the counter. This is most important if you have type 1 diabetes, as it can lead to a serious condition called ketoacidosis or DKA. Ketoacidosis can be life-threatening. If you have high blood sugar, positive ketones in your urine, extreme thirst, frequent urination, nausea, vomiting, or stomach pain, difficulty breathing, or even fruity smell to your breath, you may need to call 911 or go to the nearest hospital for treatment. DKA usually happens slowly, but if you've been vomiting, these signs can occur quickly. At this point, you may need intravenous fluids.
That sounds terrible. I hope it doesn't happen to me.
It is terrible and very serious. You can help prevent serious illness by being prepared. When you come in next time, be sure to pick up your sick day plan that tells you how to adjust your insulin and other sick day guidelines. We all get sick sometimes, but be sure you have everything you need to follow your healthcare provider's advice for a sick day. Ask at your next visit how or if you should adjust your diabetes medication and/or insulin. Have over-the-counter medications that have been recommended by your healthcare provider for things like fever, diarrhea, cold, and flu. Keep a diabetes sick day kit stocked with sodas, packets of Jell-O, soup, or broth, and emergency phone numbers. Remember, you will need regular soda and regular Jell-O, as well as the sugar-free to manage a sick day. Planning ahead can prevent an emergency room visit or a more serious illness. So Mr. Nelson, I hope that was helpful. Please call back if you have any other questions or concerns.
Thanks, that was helpful. I'll go take my medication now so my blood sugar will come down. If it doesn't, I'll call you back.
Okay, great. Well, I hope you feel better soon. Remember to take your diabetes medications even if you're not eating, monitor blood sugar more often, and drink plenty of fluids. If you cannot eat food, replace it with drinks that have 15 grams of carbohydrate. You should call your healthcare provider if your blood sugar stays over 250 or is not coming down after insulin. Your urine is positive for ketones, you've been vomiting more than 2 hours or have diarrhea more than 6 hours, or you just aren't getting better after a couple of days. Planning ahead is the best way to handle sick days. Know what to do before you get sick by having a written plan.